Hello, thank you all so much for joining us today for the 25th Annual Voices Forum. My name is Daniel Beam, Regional Ombudsman, and I'll say it is customary that we start each Voices Forum each year with the Pledge of Allegiance. So this year, John Beliciano, and a member of our Executive Board of Presidents of Resident Councils, will lead us in the pledge. John, thank you.
Good morning, everyone. My name is John, and we're about to start Voices. I would like to do the Pledge of Allegiance with you. If you will, please place your hand over your heart and let's recite the pledge together. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And actually, with that said, I believe at this time I will introduce Mairead Painter, the State Long-Term Care Ombudsman.
Like this.
We're going to put everybody on mute here. There we go. Good morning. I'm Mairead Painter, the State Long-Term Care Ombudsman. I want to welcome you all to this year, the 25th Annual Voices Forum here in Connecticut. It's kind of the 25th year. We're going to call it light, and hopefully next year we can all be back together in person to support each other and talk about these topics. We know it's been challenging. I did hear from several people about not being in person again this year and how much they missed that ability to connect and to talk about the successes that we've had. And we really want to focus on that this year, the successes that we've had with legislation, with all of you connecting, as well as looking at how we really hear your voices, right, outside of the walls of our long-term care communities. And this has been a challenging time to do this. However, as Dan said, having the opportunity to use the chat, that's the opportunity you guys have right now in order to make sure that your voice is heard, connect with each other, maybe even in a way that we wouldn't have had as an opportunity at the AquaTurf because you would have only been talking with your table. We're also recording this and it will be available to everyone to watch again or to share with your resident councils. I want to take a minute to really highlight our e-board and the work that they've been doing. I want to acknowledge that there are two members of our e-board that are no longer participating. Rita Wisnick passed away and our thoughts are with her, her family, and sorry that she is not able to be here with us, but she was a strong member of our community and thought it was incredibly important for all of us to stay united and stay together. And Brad Parkhurst, and I really want to just congratulate Brad on taking this opportunity to start a new adventure, and he has relocated, but he's going to stay in touch and hopefully he's watching this with us today. I also want to thank our resident advocates. So we've had some challenges related to having enough RAs to be in every nursing home, but the ones that we have just do phenomenal work. And one of our RAs, who was a long-term RA and had been with us for years and years, Bob Brainer, passed away. His family wanted us to know that this portion of the work that he did in volunteering meant a great deal to him, and he was just so connected to the program. So I want to thank him for all the work and his dedication. For our other RAs, I want to thank them for reaching out or using them to help us educate new people coming in. We are trying to bolster up our program. We would love to be able to have a resident advocate in every long-term care community. So if you know of someone that would like to volunteer, please reach out and let us know. What to expect today? So today we're really going to cover some ways that we can continue to connect with you, both virtually and in person, and ways that you can continue to be involved. We have seen legislation move forward that really strengthens your rights and the rights of family councils. Dan will cover that a little bit later. I'm also going to talk about the podcast that I've started in addition to the Facebook Lives, where we have regional ombudsmen doing education sessions. and go from there. I am honored today to be able to welcome our Commissioner, Amy Porter. Our Commissioner has been incredibly supportive throughout the pandemic and throughout all of the challenges that we've faced the past 18 months. So Amy, with that, I'd like to welcome you. Thank you for being here today, and thank you all for tuning in.
Great. Thank you, Mairead. And good morning, everyone. It is great to be with you today for the 25th Annual Voices Forum. As Mairead said, my name is Amy Porter, and I'm the Commissioner for the Department of Aging and Disability Services. That's an incredible privilege for me, especially to be able to work with our long-term care ombudsman and this incredible team. As I've said before, they're small but mighty, and the work of the ombudsman team over this past year to make sure that folks' rights really get highlighted in the way that they need to, that people stay connected in different ways, that we find new ways, even like this virtual forum, to make sure that there are still those connections until we can meet again in person. So a huge shout out to our long-term care ombudsman team for all the work they do and for making this event happen today. They're really committed to bringing all of us together for events like this, ensuring that we can continue these critical conversations. And even though we need to connect virtually again this year, we were hoping we wouldn't have to, but we really hope that in the not so distant future, we can meet in person. I've had the opportunity to attend Voices in person several times, and it's certainly a highlight in my schedule. So this year's theme, Your Care, Your Voice, Your Rights, keeps the focus squarely on you. It's an acknowledgement of your individual care needs. It's a celebration of your voice, and it's a recognition of your rights. So much has happened since our event last year. We have all been through unprecedented experiences. And those of you living in long-term care facilities have had some incredible challenges, and it's amazing how much you've risen to meet those challenges. And throughout all of it, you've found a way to make your voices heard. This forum, in fact, was originally established as a way to speak directly with political leaders and public officials about important issues affecting you and your quality of life. Nursing home resident and activist Carol Rosenwald, whose legacy you're going to hear a little more about later this morning, working with our ombudsman program, organized residents across the state to improve our long-term care system. She envisioned a time when the voices of nursing home residents would be heard beyond the walls of their facilities. And you, despite the challenges that you've faced, despite the isolation and the lockdowns, you've done just that. You've honored this vision throughout the pandemic by sharing your stories, by presenting real life experiences, and making your voices heard beyond your walls. This is leading to changes in our facilities, in our policies, in our thinking, and in our systems. But there's still so much to be done. Today's forum will give you some additional tools to build your message and your approach so that you can continue to be heard. So I look forward to hearing your voices this morning and throughout the next year, and hopefully in person next year. So thank you for having me join you this morning, and I hope you have a great day. Thanks.
Thank you, Commissioner. It's always a pleasure to have you here with us. Now I would like to introduce Representative Cook. Representative Cook has joined us before for our annual Voices Forum, and she is here again today. She is one of our legislative champions when it comes to long-term care and really wanting to see the highest quality long-term care. She goes out, she reaches out, and she demonstrates that leadership within her community of legislators, but also in her community up in the Northwest corner. So with that, I'd like to, Dan, begin the presentation about how to reach out and connect with your legislative representatives. And I hope you're all taking notes because this is really important and we want to see this happening moving forward. Oh no, we have a sound problem again.
Let me know if you guys are still having sound problems.
Still sound problems, Dan. We did test this ahead of time when we could hear it, so I'm not sure why we're not hearing it at the moment, but we will flow with that and see what we can.
How about now?
No.
Oh, drafts. All right, we will.
It's mostly with the videos, Dan. I'm thinking
Yes.
It sounds like everybody can hear us. We have had some computer issues this morning, so I apologize. I'm going to. Yes, they're saying they can hear us, but they cannot hear the videos. All right, I'm going to open it up in the chat. I'm wondering if people have questions as Dan's working on this. Are there questions that are out there right now that I might be able to begin to answer for people? I'm going to jump ahead a little bit, Dan, as you work on that. And one of the things that we did this year was we asked our e-board members, you're going to hear a little bit later about them reaching out to the governor's office with questions and taking information that they've received from you all and wanting to know what's happening in long-term care. This is something we're going to encourage all of you to do as well. We really want to hear it in the chat. So connect. We're going to look for you to ask peers questions, maybe about what's happening in their long-term communities around the state. I'd also like to know some successes. We have some long-term care communities doing some incredible work. We know that there's areas where we need to strengthen and bolster up, and that there's challenges, but we also know that there are some great successes. And so if you have something you'd like to share in the way of a success, please put it in the chat. We're also going to be collecting questions for our panel discussion later. So we do have individuals joining us for a panel discussion. Janet, sorry, did you get it there, Dan? Jeanette Sullivan Martinez,
Let me know.
Barbara Cass from the Department of Public Health, and Anna Drungazzi will be joining me, and we will be having that discussion. All right, so this, if our videos are not working, again, this is virtual. This is all things that we've had to learn to try to do during this period of time. What we will do is we will take this recording and we will be able to put the videos in and post it to our site. So later on, I would encourage you to sign back on and look at those videos. I will say that this may, without the videos that we have prepared for you today, this may condense a little bit the timing for today, but that's life. So we will continue to move forward. All right. Dan, do you think the podcast will work? I can jump right into that if we need to.
Oh, let's give it a shot. So I will pull up the podcast section of the presentation.
I see some questions coming in. Great. I will be looking at that. I'll be answering those. I want to give a little background on the podcast. So the podcast is also the theme for today. Your care, your rights, your voice. We thought it was really important to respond to what we were hearing from individuals throughout the pandemic. And that was that they wanted to have access to information firsthand from us. And that doing the Facebook Lives was great, but it was sort of that one time, it was very succinct and not everybody could get on Facebook. So you now still have that option, but you can also listen on Spotify or wherever you get your podcasts. You can ask any of your devices like your Echo Dots, your Amazons, any of those types of things to play the podcast. And there's different episodes. We recently released one related to Medicare 101. We will be having one about how to talk to your doctor. many special guests, and we will be covering topics that you send to me about what you want to hear. So please continue to give me the information and share what you want me to cover in those podcasts and how we can get the most important information out to you. All right, Dan, I did see it. Now there's a block in front of it, but let's see if we can play it. There you go.
Hi, I'm Mairead Painter, and this is Your Care, Your Rights, Your Voice. Thank you for joining me today. This is a special edition of the podcast, and we're really reaching out to the residents in our long-term care communities across Connecticut. Traditionally, in October, we hold an annual Voices Forum for all nursing home presidents of Resident Council. This would be held at the AquaTurf, and it would be an opportunity for residents to connect with each other, as well as local leaders and policymakers. Because of the pandemic, we haven't been able to do that in a couple of years. We missed last year, and again this year, we're going to have to use a virtual platform, which we also did last year. But we know that that's not ideal. And I actually was talking to a resident yesterday in a nursing home who said how much they miss the ability to connect with their peers and really receive the information that they get there, and they bring it back, and it keeps them energized for the next year in their nursing home and with their resident councils. So we wanted to make sure that people understood that we're trying to, yes, use different ways and virtual connections. We do hope that next year we will be able to have an in-person Voices Forum. This is something unique to our state. And after 25 years, we certainly don't want to see it sunset. So we will be looking for that again next year. However, this year, what we really want to focus on is all of the positive change that we've seen and the ability to use technology in order to connect. And this podcast is one of those things. We want to make sure that it's accessible for all of you. And then I'm bringing you information that's meaningful and really provides you with what you need in order to self-advocate and to create change in your nursing home, within the state, and at a federal level. So we're all going to be working together and want to make sure that you're using whatever listening device and wherever you get your podcasts. I know you can find them on Spotify. You can go to our website and click on them, and it'll link you right through. So we're trying to make it easy for people. For people who would rather read information, there is a great deal of information on our website, and we also have information that accompanies the podcasts in greater detail if you need it. All right, so the Voices Forum. Why did we start it? Why does the program have it? Well, 25 years ago, a woman named Carol Rosenwald worked with the Long-Term Care Ombudsman program to really ensure that residents' voices were heard outside the walls of the long-term care community. We now have a Carol Rosenwald Spirit of Advocacy Award, and this award is always given at the Voices Forum and is given to individuals that help to make sure that advocacy moves forward at a state level. This year, we are so excited to be providing this award to our Executive Board of Presidents of Resident Council. These individuals provide me with information, help to make sure that my legislative agenda is meaningful to long-term care residents and that we are doing with and not for. One of the quotes from Carol Rosenwald is, "You must hold on to your ideals and always have the courage to speak your mind." I just think that that is so meaningful, especially during this period of time when individuals have spent a lot of alone time, right? We're starting to see group activities increase. We're starting to see people come together again. But the idea of having your voice heard outside the walls of the long-term care community was incredibly challenging during the pandemic. And so we want to ensure that you all feel heard, that you know everyone is listening, and that we have the opportunity to have policymakers join us today. They will be also looking at the questions that come up and we'll be forwarding them. And that's something we take away from the Voices Forum every year. We look at what questions during the open session and panel discussion come up. Where are the areas of concern for residents, and what do they want to see happen? And then we make sure that the individuals at a state level, whether it be through the legislature or a state agency, that they have the opportunity to hear those questions, to understand where the attention is needed, and that we are going to continue to advocate and push. We want to make sure that in your nursing homes that you have meaningful resident council meetings, that you know that you can have those meetings alone. They can be private. You can ask staff to attend and take notes, but they don't have to be in the meetings. You can ask to have these meetings privately, and that should be respected. If you have any challenges or questions related to having your resident council meetings, you should reach out to your regional ombudsman and they can discuss that with you. We're also promoting family councils. We think it's really important that there are family councils to support the resident councils and that together they work with the nursing home to ensure the highest quality of care. These are things, again, we normally would be discussing with you at the Voices Forum, and I really do hope we're going to get back to that model next year. However, until then, we have the opportunity to connect with you. I do the Facebook Lives. We've had team members doing education sessions once a month through the Facebook Live, as well as on our website. And now this new platform, podcast, and yes, it's new to me as well, but we want to try to do everything we can to reach every resident in long-term care. We want you to be able to go on and listen about your rights, about Medicare, how to talk to your doctor, just anything that comes up where you think you need more information about it. We will do the research and get it for you and bring on other leaders, right? Other leaders, experts in the field to discuss topics with you. So please continue to send in those ideas and we will continue to post them on the podcast. We're hoping to have podcasts posted either 2, maybe 3 times a month, depending if I'm able to record that many. We want to make sure that it's information that you all can use. So thank you for joining me. Thank you for being here for our Voices Forum. You can also look at the information from our Voices Forum on our website. It goes back, I think, at least 6 or 7 years on there where you can look at information from the past. A lot of it is still very pertinent, and really encourage other individuals in your long-term care community to get involved with your resident council. Thanks for being here with me today. Please continue to listen to us on Spotify and wherever you listen to your podcasts. This is your care, your rights, your voice.
All right, so there you have it. Again, it's a new platform for me, so I want feedback. I'm fine with critical feedback, as I know it's different. And it's harder than you'd think to talk to yourself sometimes. I know probably the ROs and my family think I talk all the time, but you know, we really want to make sure that it's meaningful interactions. I love that you guys are putting questions in the chat. Oh, still no voice. Anyone hear her? Hoping you can all hear me. I see it sounds like some people can hear me. And because, okay, they can hear me. Because we are doing this live, we're going to change it up a little bit, right? Sometimes things don't go the way that you plan. And I want to give a big thanks to Dan Beam and Lindsay Jessup, our regional ombudsman, who've worked so hard to put together this program today. And even though things aren't going, I know there's some frustration that it's not going the way that they planned, but that's how we roll. You just heard in the podcast about our Carol Rosenwald Award. This award is so important to our program, and I cannot be happier. We punked some people. If you know what punked means, we surprised them. So I know that Jeanette is on here, Jeanette Sullivan Martinez from our Executive Board of Presidents of Resident Council. And we went to her nursing home about a week and a half, 2 weeks ago to surprise her because yes, the E-Board this year, the members of the E-Board are receiving the Carol Rosenwald Award. They did just the most amazing level of advocacy this past year, reaching out to their legislative representatives, making sure that the governor's office was aware of what was happening. Part of the NAWLOG, the Nursing Home and Assisted Living Oversight Work Group.
Nailed it.
They participated in that, and the Mathematica report, as well as regularly reaching out and touching base with me. So Dan, I don't know if Jeanette is available at the moment.
Yeah, Jeanette, if you're around, I think it's fun. It was actually a very difficult process to give the awards out this year because everybody wanted to give it to other people. And so the e-board actually thought, and I think it's interesting, they unanimously voted that they thought Mairead should receive the Carol Rosenwald Award because of her dedication and advocacy that she's been doing. Meanwhile, Mairead and our team felt that the e-board certainly had been working so diligently and were so dedicated to testifying remotely and making sure the voices were heard, reaching out to legislators, that we thought it was only appropriate if they got it. But neither knew that the other had elected them. And so it was really interesting. And I'm not sure if Jeanette, if you're available to pop on and kind of speak to this experience, because we nobody knew and we had to give out the awards as such. And so it was a really fun day. And for the other members of the e-board.
That's not live though. That's just a picture. Okay.
Right.
There we go. And there's Jeanette.
Hello.
Jeanette,
Can you
thank
hear
you
me?
for joining.
Can you hear me okay?
We can
We
hear
can.
you.
Can you see me? Can you see me? Now, hit the top button, Lou, and on see, so this is start video.
I gave you a little prompt there. I might be able to click
Okay,
that.
right there. So hit okay. See, no, in the middle, right in the middle of the screen. See where it says okay? Ta-da!
Here
There
we
we
go.
are. Hi, everyone. Good morning.
Thank you so much. And yeah, so
Good
Jeanette,
morning.
I know you also shared that experience of, really wanting Mairead to be the one, as the e-board, you guys had collectively made that decision. And so we were, secretly trying to work to make sure that when we were giving out the awards that she didn't know about it.
Yeah, we had to really plot and plan in our weekly or monthly meetings that we got together with just the executive board members. And then I was quite surprised when you turned around and punked me with it myself. So Mairead, I just can't thank you enough on behalf of our executive board members, but also all of us residents living in the state of Connecticut. You and your team have worked very, very hard this last year to really try to make things better for us. And it's so much appreciated because we're starting to see the benefits of that hard work. And I just want to encourage the rest of our resident council presidents to really work with your facilities, your administrators, your staff, really work with your residents to really be a voice, because it is collectively that we are able to make changes. Yes, one person can be very significant. As we've seen, Mairead has really taken the reins and helped us and has brought her team along. And I feel very proud to be part of that team. But all the residents in the state of Connecticut, you are also part of that team. So feel free to use your voice and reach out and speak up for those things that are important to you in your home specifically, but also collectively, we can all make a difference. So thank you, Mairead, for all the hard work that you've done on behalf of all of us in nursing homes.
Thank you, Jeanette. And I have to tell you, that was so meaningful that day. You guys totally caught me off guard. We were joking about the word punked. We all kind of got punked. We thought we were there for different reasons and got surprised. I will say that it does take a team. Someone said earlier this week, it takes a village. And I do feel that everyone here is a part of my village, from the commissioner to our support staff. So we talk about the ROs, you all know the ROs, but not everybody knows our additional support staff. So we have Deb and Stephanie, and they are amazing. They take the calls. They're the ones that when you call up, you get, and they make sure when there's an issue or concern, something happening, that it immediately gets escalated appropriately to one of the regional ombudsmen or myself. So I want to put out a huge thank you to them. I also want to let people know that Desiree Pina, my administrative assistant, who many of you have connected with over the years, has retired after close to 30 years with the state and the program, has taken this opportunity to start a new chapter. So I want to put that out there. But in accepting my part of the Carol Rosenwald Award, I'm accepting it on behalf of myself, but also my team and the people that allow me to be able to do the work that I do. And so thank you. And Jeanette, I am so proud. Nationally, you all have a presence. your voices are being heard, and that is the whole mission behind the work that we're doing. So thank you. At this time, I want to talk about another punk that we had.
I
So
was
Jeanette,
going to
stay
say
on.
it would be only appropriate to raise that Mairead and Jeanette were not the only two who were punked that day. We actually were able to coordinate our Brian Capshaw reward recipient to get theirs as well at the same time. And so Mairead, if you want to talk about that.
Absolutely. And some of you may not know who Brian Capshaw was. And Brian Capshaw was an incredible person who happened to live in a long-term care community. And I say it that way because Brian never let where he lived define what he could do and what he could accomplish. And he pushed all of us to keep that in mind. And at a national level, Brian was really known for his advocacy and making sure that individuals who chose to receive their long-term services and supports in a long-term care community continued to have their voice heard and their rights respected. And so we have a rock star. Brian was also really into rock and roll and music. And so we have a rock star award that is given every year in his honor. I'll share a little story. He was such a rock star fan that once when we were advocating in Washington, D.C., where he got himself and met me, we went out with one of the regional ombudsmen and some other advocates one evening. And we went to this place. There was live music, there was dancing, there was fun, and he was all in. And that was the spirit of Brian, all in all the time. So when we give this award, we really talk about looking for someone who's all in and at a federal level, really advocating for meaningful interventions in long-term care and making sure that the voice of the individuals continues to be heard. And we unanimously felt that the person that received the award this year, we couldn't have been prouder of, and that's Liz Stern. Liz Stern has been a rock star. She has been advocating at a state and federal level, dealt with a lot during COVID related to her parents, and I share that because she has openly spoken about that. I don't know where she gets the energy. I know, Jeanette, that you and I have talked about that, and whenever there's a question or a concern related to how families might respond, we reach out to Liz. She was also part of the Mathematica report, part of the nursing home and assisted living oversight work group, and she has been steadfast in working towards having something called an essential caregiver. So I want to make sure that you all know that this is something we are continuing to work on. There is a federal bill pending. Yes, we passed a state bill for essential caregivers, and we are working on the rollout and formalization of that. We're going to talk about that in a second. But at a federal level, HB 3733 is something that Liz has poured herself into. And this bill would ensure that residents would never again have a long period of time where they did not have access to at least 2 people of their choosing as essential caregivers that would be able to come in on a regular basis, a daily basis, and see them to offer those essential supports. So what's an essential support, you might ask? An essential support is as much as emotional, physical, anything that helps you reach your individualized goals. So thank you very much. We see somebody just put up in the chat a connection to that. And yes, we do have, was that you, Dan? I'm trying to think who did that. They do this to me on Facebook too. People just start throwing stuff up for me. But Liz did that. She worked hard. She continues to work hard. They're advocating and also working on a statewide family council. We have resident councils, and we know your resident councils, like we've said before, are sometimes supported by the facility, right? By your nursing home. You can ask to meet privately. But we also have family councils, and not many buildings have family councils. So we're really encouraging everyone to have a family council. We have a statewide family group that is mailing out information to your administrator. You should ask about it. If you have a family member that wants to start a family council in your building, we would really encourage them to reach out. If they need support, the regional ombudsman can help them. But we are also now going to have something called a statewide family council that our program is supporting. They will be on a Zoom platform and giving monthly information out to each nursing home. And We are giving this honor to Liz, but there are a group of family members behind her that support this as well. So more to come on that. We are getting it up and going. But I'm just so proud, and I'm so proud of Liz. The spirit of a rock star. So thank you. Dan, I think at this
Great.
point, since we weren't able to do the video, and I think it's a really crucial part of Voices is the legislation that we've passed and that we continue to work on. I'm wondering if you can give a live update. Sorry to put you on the spot, but I'm wondering if you can do a live update on our legislative agenda, what we passed this year and where we're headed.
Absolutely. And thank you so much, Mairead. And thank you so much again to our e-board members, to our residents, to fellow advocates, families, and stakeholders. Also, I'd like to give a shout out to Dan Lerman, who in the video presentation was able to provide his overview, his macro overview of the legislative session and some of the progress that we've made. But at this time, I'm going to get into the specifics, some specific bills that passed, some really important ones that we think are important to highlight as we move forward for the 2022 session and the progress that was made in the 2021 session. And so let's see here. So the first bill that I want to touch on today is the Essential Caregivers Public Act 2171, previously 6634. This was effective from passage. This bill allows long-term care facility residents, their representatives, to designate an essential support person and a secondary essential support person who may visit the resident despite general visitation restrictions, which may be imposed on other visitors subject to DPH guidance. This bill applies to residents in nursing homes and managed residential care communities, which provide assisted living services. The Ombudsman statute is also expanded in this bill to specifically include resident supports for socialization, visitation, and the essential support person access. And so, as Mairead has mentioned historically through the Facebook Lives, and we'll mention again, and that we want you to guys make sure, is at your individualized care plan meetings to make sure that you're designating these essential caregivers for yourself, so that if there are visitation restrictions imposed, the facility knows what your individualized needs are and how these individuals may be able to assist you, even during traditional visitation restrictions. The next bill I want to talk about is Public Act 21185. This was previously Senate Bill 1030. This is an act concerning nursing homes and dementia special care units. And there are a couple provisions in here that I think are really, really important, and we've been working really hard on, and so happy to see some progress here. So this bill, effective dates vary within it, but most of them took effect October 1st, just last week. So some of the provisions are that they require that the facilities employ a full-time infection and prevention control specialist. Also, that the nursing homes maintain at least a 2-month supply of personal protective equipment for their staff. Also requires that nursing homes administrative work, that they have at least one contracted or in-house person on each shift who is licensed and certified to start an IV line for residents. The next provision, huge. We've been advocating for over 40 years for this. That was the last time we saw an increase to the minimum staffing ratio. And so the minimum staffing used to be 1.9 hours, but now, effective October 1st, it requires that nursing homes provide at least 3 hours of direct care per resident per day. It also requires that there are establishment and maintaining, that facilities are obligated to work to establish and encourage the establishment of family councils and encourage the support and open communication between facilities, residents, family, and friends. Another huge bill that greatly benefits the rights of residents in nursing homes and long-term care facilities is Public Act 2155. This was previously Senate Bill 975. This is an act regarding the long-term care residents and virtual visitation and virtual monitoring. Took effect October 1st, and this bill specifies the access rights and limitations to residents' audio, video virtual recordings, and outlines the Ombudsman right to request responsible parties about recordings that may corroborate abuse or neglect allegations. Now, in the bill, it notes that the residents are responsible for paying for the technology and its installation, but the nursing home is responsible for providing the internet access and the power to run the devices themselves.
Dan, while you're on that one, I just want to jump in and say, this is a bill that we had historically tried to pass related to camera use. And I really want to honor our aging committee here within our state, because they saw past that and saw that we'd have to keep going back every year if we only acknowledged camera use. And that's why it really speaks to technology. And that's something we learned during this challenging period of time, that there's lots of different types of technology, and why we moved to the podcast, that individuals use, and not only for virtual surveillance, but for connectivity. Having a camera in your room allows you to do things like this, to stay connected to family members. If it happens to capture something, that's different as well. But we want to make sure that you know there are now forms up on our website talking about the permissions around these cameras, how to have them placed in your room, as well as we want to hear from you so that we can actually bring it back to the legislature, how you do use them and what you do in the way of technology to stay connected in your room. Maybe you're watching, I don't know, Jeopardy at night with your little Echo or whatever, and a family member's on the other side and you're answering the questions together. All of those are really meaningful interactions. So we want to know what creative ways are individuals using these. Do certain homes encourage them in different ways? So give us feedback, because when we provide that to members of our legislature, I think it's very meaningful for them to see how the bills that they worked on and passed after we advocated have made a difference in all of your lives. So sorry about that, Dan, but I just wanted to jump in. Thank you.
Certainly a great point to that. And again, you know, with the spirit of voices and collaborating with each other, collaborating with the Ombudsman program throughout the state, I think it is important. If you guys have any products, services that have been beneficial to you in your experience, feel free to put it in the chat. Let others know what products you guys have been happy with and how your facility has accommodated you to make sure that you are able to have virtual visitation as you wish, how you wish, with your loved ones, with your family, with your friends. And again, I know the technical difficulties, sorry to report, but I did, in these PowerPoint presentations, I did include links to all of the specific bills themselves. We'll have those up probably early next week, right on our Voices event page, so that you can come back, reference this material, reference these bills specifically. So as you're talking to your administration about your rights, about the things that are happening moving forward, and or with your legislators, to thank them. Thank you so much for passing these bills, or let them know where there's still work to be done. You can go back, you can reference the specific bills as you have those discussions. So again, thanks, Mairead, for making that point as well. Another huge landmark bill that I'd be remiss not to speak about is the Appropriations Budget Bill. It was a huge bill, House Bill 6689, turned into Special Act 2115. But again, we've been advocating for over 10 years. And Jeanette, I know you personally have been advocating for this for years, and I know it was a great feeling to know that this had passed at this session, was that the increase of the personal needs allowance for specific long-term care residents that are receiving Medicaid was increased effective July 1st from $60 a month to $75 a month. And I know to some it may not sound like a lot, but one of the things that the executive board, made clear, and residents across the state made clear to me is that is a big increase for them. And the, when you're working with $2 a day, it's a big change to be able to have those extra things to make your life a little bit better. And so making sure that you guys are aware that as of July 1st, that did increase, and individuals on Medicaid should have access to an increased personal needs allowance. Another huge bill that I wanted to touch on, again, this was a historic session where bills that we've been fighting for years that hadn't gotten any traction passed. And at the end of this presentation, I have a list of a tremendous amount of them, but these are the highlights. These are the big ones that I think are important for us to touch on. This one, Public Act 21194, previously Senate Bill 973. This was effective from passage. This applies to nursing facilities and managed residential care facilities that provide assisted living services. This legislation requires the input from resident and family councils at long-term care facilities on any statewide policy affecting the living conditions or residents of such facilities. It now mandates and requires that any agency or legislative committee that's putting forth legislation that would affect the living conditions, residents and family councils are to be notified. They have the right to request response from their legislators, and they're required to hold a public hearing at the request. If 15 or more people voice that they have concerns or want to discuss it, they're obligated to hold a public hearing. And not only are they obligated to now hold a public hearing on it, but they must accept testimony from any individual in a manner, in a format that provides the most input from these members, meaning including remote testimony. And so this is something that Connecticut, I think, is at the forefront of things. And I'm really happy to know that this increases our availability to testify, to provide our voice, to connect you guys with your legislators, because no more are you required to schedule weeks or months in advance to get the transportation, to go out to the Capitol, wait for hours to testify. You now have the ability, a direct connection to voice that with your legislators. So another huge landmark bill for us.
Dan, I want to pop in there and acknowledge Jeanette, because Jeanette's one of those people that's done that has taken that ride, gone on that transportation, sat all day, and then had just that 3 minutes to testify and answer questions. And it was very meaningful, and I think had an incredible impact on the members of the legislature that we were trying to reach. And so now being able to do it right from where you're sitting, Jeanette, and connect, and you did a great job throughout the session of connecting and bringing your voice forward in a way, but that also allows you to be totally present and not impacted physically. You know, it's a lot. That's a lot in a day, and you have to stand in the line and go upstairs. So I think that this will be incredible for our ability to move things forward. So I want to encourage all of you, if you're nervous about testifying, if you have questions, if you have concerns, Dan has really laid out on our page how to do that. We can talk to you about it ahead of time as session comes up, but we post what bills will be coming up. And then we'll go over even how to address, right? How to address your legislative representatives. And so please, 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 please consider testifying on bills as they come up.
Yeah. And I wasn't able to get the audio working for Representative Cook's presentation, but she, of course, she touches on, again, the power that you have as resident council members to raise your voices collectively. And that was some of the progress that the e-board was doing this year, that we felt at the Ombudsman program, why it was so important to provide and make sure that they were awarded for it, because they were instrumental in demonstrating that virtual testimony was providing an opportunity for legislators to connect with the voice of a population that they previously weren't really connecting with in a meaningful way. And so, shout out to the e-board for all the hard work that you guys did this last legislative session to make those changes and to help the legislation see that there are significant concerns that you guys are voicing, but they might not have been hearing. And so, again, encouraging all resident councils to invite your elected officials to your home, inviting your elected officials to a teleconference or a virtual conference via Zoom, like you would do with your family, that you'd like to discuss, satisfactions of things that have happened, also maybe some concerns that you have moving forward, because although it's always best, of course, to be there in person, we're getting some opportunities. We're seeing those tarnished silver linings about ways to work with the technology to our benefit. And Mairead, you had touched on this previously, but I also did want to touch on it. The federal advocacy, although the Connecticut session is over, that doesn't mean that the federal advocacy doesn't have to stop, especially right now. And, you touched on HR 3733. This is the federal Essential Caregivers Act led by Representative Claudia Tenney and John Larson. And this would allow essential caregivers access in long-term care facilities to provide the support during any public health emergency. Because right now, the guidance comes down from the feds, and even though we have approval at the state level, we want to solidify that, reassure that, and ensure that moving forward, you have those rights ingrained in federal rights as well.
And Dan, to that point, we did have a question in the chat about that. Like, how do you appoint someone as your essential caregiver? What does that mean? And so what we're asking people to do is to ask them in your care plan meeting or ask to have a care plan meeting and to let them know who the 2 people you see as essential in your life, essential support people, and have them named in your plan of care. You can also describe how they help you meet some of your daily goals. And again, that can be social and emotional as well. I think sometimes people see their care plan meeting and they think only medical, right? They think very medically, but you have recreation in there, how you spend your day, how you make that known. And that's through your plan of care. All right. And making sure that that's all documented. It's extremely important that you all attend your plans of care. I know people say, I've been doing this for years. Why do I have to go again? Well, things change, staff change, and that's where you would document this, and it would give you access, again, to 2 people. One thing that I'll highlight is that it says that the people have to, whoever you acknowledge or deem your essential care person, they have to be able to follow whatever the safety protocols are during that public emergency. Okay, so what does that mean? Well, this public emergency had a lot to do with infection control measures. And that means masking, hand hygiene, physical distancing. So the person that would be appointed would have to be able to do those at the same level and the same expectation as the staff. Okay. A different public health emergency might have different requirements. Maybe it's a hurricane. I had said zombies at one point because I figured that wouldn't really offend anybody. So if it's a zombie apocalypse and someone shows up and they had a bite mark from a zombie, they may not want to let them into the long-term care community, and they'd have to provide them with notice as to why they didn't let them in. And then they could contact our office and we would try to support them through that. If they started to change into a zombie, I wouldn't have them go in. But that's just an example of really requiring that the person be able to uphold whatever those core principles are for the safety of everyone within your community. I did see, we did get a request that Dan and I also do speak very quickly. So we'll try to slow it down a little bit. We can be fast in the way that we pop along things. So thank you. I really appreciate that feedback. I know that we can move quickly at times. So thank you.
Of course. And again, I think you guys have done a great job of letting us know at the Ombudsman's office how you feel. Many of you residents and families, I know this last legislative session did reach out to your elected officials to report where you were having troubles historically. And again, the backdrop of coronavirus has been, the effects on us all have been incredible. And to know that your voice is being heard is tremendous in that. And so again, reminding you to reach out to your local elected officials. We'll be putting contact information or the links in the chat here of how you can reach out, who your elected officials are. You can go to the CGA website and find out, and they can provide, and then you can reach out to them and let them know, what your concerns are. Again, as Mairead mentioned, you can reach out to the Ombudsman program. We are happy to work with you in your resident council to do a presentation on best ways to approach your legislator to get the change and effects that you want and you need. And so again, all these links will be provided in the PowerPoint that we'll put up on the site after today as well. And as I mentioned previously, there are an incredible amount of bills that were passed this year related to long-term care residents. And you can find all these links on our advocacy page. But I also did provide direct links here if there's one in particular or multiple in particular that you find interesting and want to look at the specific verbiage of.
And Dan, there was a question about what if a resident can't do this on their own? And so our expectation would be, one, you can always reach out to us. As we said, these links are on our website, but maybe you don't necessarily have easy access. Your long-term care community, your home should be working with you. You can ask the social worker to support you, to give you a half hour, an hour to go through, to look at the site. Recreation should be supporting you. And if you want to reach out to a legislative representative, that you have the opportunity to do that and that they support you in that and assist you. We had one state rep that actually went out and met with a resident council this week. Took a late afternoon, went there, addressed concerns, and is going to continue to follow up with them, has made himself very available. So we have another one that's going out in a few weeks. So it does happen. I think it's important, and we need to encourage all of our legislative representatives to understand that even our nursing homes, our residential care homes, our assisted living communities are part of our greater community, and that you are all members and constituents of theirs. With that, Dan, I'm wondering if, we'll see if it works. I'd like to demonstrate how the e-board asked questions to the governor and what those looked like. I don't know if we could try to pull that up. We'll try another link here and see if it works.
Certainly happy to try that. I've got queued up. I think it would be great as well to try to get with some time that we have left, the Michelle Cook piece. And so I'm going to try that. If that doesn't go through, then we'll switch gears and we'll try to get the governor's bit. So bear with me.
Sounds good to me.
And so just put in the chat if you guys are not able to hear this when I put it up.
Still no sound, Dan.
Well, that was a quick test. And bear with me, I'll pull up the questions to the governor. Yeah, and if you could, right, if you wanted to talk to, our goal with this, again, keeping the momentum going with our legislators and thanking them for what they've done, but again, pushing them to still hold them accountable for some things that we feel are still left undone.
Absolutely, and to keep this light shining on our long-term care services and supports. For a long time, I think there's a portion of our society that people really didn't see, didn't know. They thought that it was all much older adults living in these communities that maybe didn't have the ability to interact. Everyone has a significant memory care issue. Everyone has family or people who take care of them and are all set, don't want to participate in this way, when that's just not correct. We have individuals that are very capable, whether they have a memory concern or not, they're still able to make their needs known. They're still able to communicate what's important to them. And then we have thousands of other residents that are there maybe for different reasons that are perfectly capable of telling us what's working and what's not working. And so this was our opportunity to show that. We showed it, the light is on it, and we want to keep this momentum going and keep those voices being heard. So let's see if this works, Dan.
Very good. And let me know.
Hello, Governor. My name is David. I am a member of the statewide coalition of presidents of resident councils. I am currently in independent living here in Hamden. And I would like to thank you first for the increase in staffing to resident ratio that was recently passed and signed in by you. That's very important to both residents and staff. Residents are able to interact more with the staff, and the staff get to know the residents in a more personal manner. They get to know their needs, they get to know their wants, and they get to know and to conversate with them, to be able to know them not just as essential caregivers, but also as people that are interacting with these residents on their day-to-day lives. The question, though, is knowing that we have a dire need and the work shortage is there, what can be done to bring in more people into this field? It's a very what's the word I'm looking for? I'm going totally blank. Wait a minute. It's a very totally blank. It's a very rewarding field to get into. As somebody who was in it for over 30 years, I found a lot of just joy in being able to make the difference in people that are in the residences. So what can be done to bring in more people into this field, into this profession? It's not a job. If you have the calling, It's your calling, it's your career, and it's very rewarding. We need to be can something be done to bring more people into the workforce and to be able to supplement change in staffing to nursing resident ratio? We have to have the staff to implement what you have so wonderfully done in increasing that ratio. However, we do need the staff there. So can we get more people interested in this field? Thank you.
My name is Jeanette Sullivan Martinez, and I am president of the statewide coalition of resident council presidents. My question for you is, during the pandemic, there was funds provided to nursing homes to assist during the pandemic, which was supposed to go for staff wages. Is there a plan, or do you have one that you're preparing that would show accountability that these wages went to the appropriate people? Thank you, and I appreciate your time, and I look forward to hearing your response to my question.
Good morning, Governor. My name is John Beliciano, and I sit on the E-Board with other resident council presidents. As a result of COVID, nursing homes lost residents because of COVID-related issues and other issues related to the pandemic, such as isolation and depression. Therefore, nursing homes are not at the full capacity in terms of the census. This has a direct impact in the quality of care of the residents. Do you have any ideas on how to fix this problem?
Hello, Governor. My name is Martha, and I have been living in a nursing home in Manchester for almost 9 years. I would like to know what you see is the impact to the residents when the nursing home has to chronically hire other agencies to take care of the residents. And hello, Governor. My name is Martha, and I have been living in a nursing home in Manchester for almost 9 years. I would like to know what you see is the impact to the residents when the nursing home has to chronically hire other agencies to take care of the residents.
Having a little bit of difficulty playing that last one. But the question ends with, chronically has to hire staff who might not necessarily know, your needs or desires because of difficulties with staff retention and using pool agencies. And so, with that, this is a good example of how we are hoping to have individuals voice to their legislators, to their governors, questions or concerns. We submitted those to the governor himself. We're hoping to get response. Again, we were hoping he was here today. He was unable to join us because of last minute issues that had come up on his end. But we are hoping that he might be able to address them. And then it looks like Michelle Cook has been able to join. And so, Michelle, we did have some technical difficulties prior to you joining today, but we are so happy to have you here. And I'm not sure if you have a moment just to, sorry to put you on the spot, but speak about the need to use your voice, the last year and what it meant to you as a representative, and a few tips and tricks you might recommend to individuals in order to best engage with you as a state rep.
Good morning, Dan. Great to see you. What are you saying? That great video didn't work? I'm just kidding. So, and good morning, Mary. It's great to see you as well. And everybody that's out there, you know, it's an honor to be here, and I'm glad that you all are here with us and safe and, you know, and healthy, and that we've been able to get this far through a crazy pandemic and be able to have a conversation. So to your question, Dan, about how I find it to be important to use your voice and how I would suggest that you do that. You know, talking to legislators, myself, you know, I've been in the office now going on 14 years. And so for me, it's about the personal stories. And I find that to be most common with all of my colleagues, that is definitely about the personal stories that make a difference. Those chain emails, the form letters, all of those things, especially if you don't put your name or your address on it for us to identify whether or not you're from our community or somebody else's community. You know, I don't want to spend my time listening to somebody that is in California. I would rather spend my time listening to somebody, you know, it first starts in my town and then goes to my state. And that's what's important. And apparently my neighbors are putting on solar panels. So if you give me 2/2 a second, I'm going to shut this window and I will be right back. Don't you love modern technology?
All too well, all too well.
Yeah, this has been our whole day today. So this is great. This is us being real, right? Like we're in person. This is good.
Traditionally, I would say I exited stage left, but that one was stage right. So I'm apologizing for that. You know, it is about the personal story. And I don't know. So Dan, you didn't get to use the video. Is that what I understand?
Yeah, the video, I wasn't able to get the audio on it. And I know in it, you had talked about engaging with resident councils and some ways to use them to amplify their voices.
Well, no, I just didn't want to repeat myself if you did. So I want to make sure that in the video, I had spoken about telling a story and using your voice. And I used the example of my father-in-law. And my father-in-law, you know, to no fault of his own, had to be in a nursing home facility, and it was supposed to be temporary. He went in because he had taken a fall and he was legally blind. And he would always tell the caregivers that walked into his room, don't forget that I'm blind. Don't forget that you can't leave me alone. Don't forget that I need to have some help here. And he was always advocating for himself, and he was always using his voice. And he didn't know, and I just came in on the end of the prior conversation about having the temporary agencies walking in and and caring for folks. And that was really part of the problem that he struggled with. So if you had the constant caregiver, that was there every day or every other day, that knew him, knew his routine, and knew his pattern, then he would not always have to remind somebody time after time after time, I'm Bill, and don't forget I'm blind and I can't walk by myself, kind of a deal. And I can't see very well. And when he was using his voice, it was truly where I learned about, not that I didn't understand advocacy, but I always thought that it was kind of trivial in nature. Like, Pops, why are you telling them over and over and over again, I can't see, that I'm blind, that I can't walk by myself. Like, why are you telling them over and over and over again, they work here? And he goes, Michelle, because they're not the same people time and time again. From one shift to another, from one day to another, it could be somebody totally different. And even in his facility, because there was 3 floors, he was on the rehab floor, and they kept him on the rehab floor for 10 months by our decision. Because there was constant people there, and you knew that it was the physical therapist, and you knew that that was traditionally the more steady work crew. But when the pandemic hit, it became much worse, and it became to where, people weren't able to come to work, whether they were ill, they weren't comfortable coming to work, they had family members that weren't there, or they were simply just afraid to come to work. And so you had people from all over the place that were coming in, and for him, it was exactly that. I'm Bill Cook. I can't see. I'm not able to walk by myself, et cetera, et cetera, et cetera. And he always relied on his roommates to fill the void where he couldn't. And the reason why I bring up my father-in-law was because we lost him April 2nd, 2020 due to the pandemic. He was very early on. And they had called on a Friday, and they said, we're moving your father-in-law upstairs to a much safer unit. And he says, I don't want to go. They don't know me there. You won't be able to see me. You won't be able to come and knock on my window, because he was on a ground floor. They don't know me there. And as a family member, you say, it'll be okay. You know, we'll be in constant communication, et cetera, et cetera, et cetera. And within 24 hours, we got a phone call that he was just not himself, that his personality had changed, and that he was running a temperature. But they didn't know him, and they were very clear about that. We don't know, like, his disposition and his demeanor. We did not know that what was going on with him was different. The only thing that they knew was different was that he was running a fever. He wouldn't even talk to us. He was just angry and frustrated, and he would not have a conversation with us on the phone. And then within 24 hours later of them moving him from his floor that he had been on for 10 months to a second floor, he was being admitted into the emergency room with the fear. We felt that the fear was that he had COVID, and the nursing home had told us all along that there was no COVID in the facility. Now, he had not left the facility. And we obviously hadn't been in, so we're not sure where that contracting came from. But at the end of the day, the reason why I use my father-in-law is very simple. He had a voice, and he knew how to use it. He was often afraid sometimes to use it, because as we all conversate about the fear of retaliation and who might be angry and who might feel that you got them in trouble, I think that as a group, we need to stand together and not allow those things to happen. But if somebody does not say something to somebody else, and I would say, you know, talk to your family members, talk to your loved ones, talk to your friends who are talking to you, whether they're visiting or on a phone call or on a FaceTime, let them know what's happening. Because the more people that know, the better our ability to have accountability is. And I use the example of a granular of sand. And one granular of sand is really minute, and it's very difficult to make a difference. But you put a lot of granulars of sand together, and it becomes a beautiful beach, and you have the ability to affect people's lives and make good change. We all know how comfortable and happy and lighthearted and, you know, just relieved that we are when we're walking on a beach, and we're walking on a whole bunch of granulars of sand that are changing our life. If we all work together to become those multitudes of sand that work together, we have the ability to change lives. Not only for the lives of the folks that are listening, but for the lives of the folks that are going to come on well past our time here. And for me, it's been so vitally important to be able to use my voice to advocate for folks that sometimes might not be able to advocate for themselves. And what that means for me and my partnership with all of you and your friends, your families, and your loved ones, tell your story, as my father-in-law told his, each and every day. Use your voice to make a change. Call your legislators, write a letter, send an email, but please put your address down. I mean, I know a lot of times a lot of times nursing homes don't change your address. And, so my father-in-law was a Waterbury boy, but he was in a nursing home up here in Torrington because he was closer to us. But his address was still Waterbury. So if they were going to generate a letter for him, he would have signed, Bill Cook, and it would have generated from a Waterbury address and gone to a Waterbury legislator. Now that still matters because he still had a house there and still paid taxes there. But that Waterbury legislator might not have been the one that was going to go to the Torrington nursing home and visit him and sit down and listen and talk to the resident councils. And that is so vitally important. Bring us in. I've sat in our resident council meetings, but in only one facility. Nobody else has asked me to attend. So
We just told them to ask you, Michelle, so you guys might be getting calls. We've actually had a few reps recently go out and attend resident councils and said it was very eye-opening for them. And we think that that's incredibly meaningful.
Well, and that for me, I was attending in dual roles. I was attending because I'm a legislator that has been covering Torrington now for 13 and a half years, but I was also attending because I was a loved one of somebody that was in a facility. And in the facility that my father-in-law was in, he was my third loved one that was there. And in the 21 years, so my grandmother was in the same facility 21 years ago, and then my mother-in-law about 8 years ago, and then my father-in-law. And in those 21 years, there's been such a vast change.
Mhm.
And
Long-term care in general has changed a great deal. In
100%.
Yeah.
And so family members might not know what is happening inside. And it is vitally important that you all keep those, those open communications. We all have phone numbers in our office at our desk. We all have our own personal emails. Traditionally, our home phone numbers are listed or accessible, and our home addresses are traditionally listed and accessible as well. I get letters, handwritten letters to my home. I get handwritten letters to my office, and then I get calls on my phone. But again, if you don't leave your name, your address, or your phone number, I won't know how to return a response to you, and it really matters. And if you're emailing, do the same thing and say, I'm in a facility in your community, and that matters. Or if you're paying taxes for a house and you're temporarily somewhere else, both legislators matter. And
we
hold them accountable.
Appreciate that we've said that you didn't get to hear me introduce you before your video, but that you've been a champion for long-term care, and you're on the Human Service Committee, and all of the work that you've done. We have other state reps on here, I think, as well today, and it does matter, right? Those voices. And we're actually going to take some live questions. I think we're going to move into our panelists session. So
yeah.
Michelle's going to stay on. I want people to ask us if they have direct questions on how to connect to you. We're also joined by Barbara Cass. So I see Barbara's joined us. Hi, Barbara. Welcome.
Good morning, everyone. Thank you. It's a pleasure to be here today.
Thank you for being here. And Jeanette Sullivan-Martinez from our Executive Board of Presidents of Resident Council. And Anna Drungazzi from AARP. I know I saw Anna. There you are, Anna. Hi.
Hello.
How are you?
Great. How are all of you?
Good. So I know that obviously Rep Cook, we know what she does. We know where she's from, and we will have that video up live on our site for people to click on and watch. Barbara, I don't know if you can give a little snippet or introduction, what you do, your role, and why people would want to reach out to you.
Thank you, Marie. So good morning, everyone. Again, it's a pleasure for me to have this opportunity to spend some time with all of you. I am the branch chief of healthcare quality and safety at the Department of Public Health. I wish I could say that business is back to normal. It really is not back to normal because we are still working through implications of COVID-19 and all of the unintended consequences of all of the work that we've done. And I know Marie and I had exchanged text messages earlier, and I know there are lots of questions about staffing, the utilization of staffing, and how facilities are accessing staffing. So happy to talk about that. Also happy to talk about anything else that you may have, and we can also maybe do a quick check-in with where we're at with executive orders. So I will stop there, Marie, recognizing that there are others that are going to introduce themselves. Sorry. Thank you.
No problem. No problem. Thank you so much. And we know how crazy your schedule is, Barbara, and I also really appreciate you taking the time to be here today. Anna, I don't know if you want to give us an introduction for yourself, let people know your role at AARP and how we work together.
Sure. So my name is Anna Doraghzi. I'm one of the policy directors at AARP Connecticut. I was so excited to see so many familiar faces in today's presentation, and to see some names that I know in the chat and in the videos. So hello to everybody. One of AARP's overarching missions is to help people choose how they live as they age, which I think is a mission that aligns really nicely with the work that the Ombudsman program does. So in my role at AARP, I advocate for legislation, for policies that advance that goal of helping people choose how they live as they age. There's a second policy director in our state office that deals with senior fraud and tax incentives and utility bills and really important pieces like that. And I tend to cover more on the healthcare side, long-term care, what we call livable communities. So it's always a pleasure to work with the Ombudsman program. The e-board, I adore. I think you all do really amazing work. And it's been said a lot during today's conference, but the leadership that you have in Mairead and the advocacy that you have through the e-board and through advocates like Liz Stern is just unprecedented. What you've all been able to do together in the last year is generational change really for folks in long-term care facilities. So excited to be with such a great group today.
Thank you. Thank you so much, Anna. And I want to recognize, for people who don't know, it is actually recognized at a national level, the way that partnerships happen here in Connecticut in a way that is unique and I think isn't seen across the country. With family councils, resident councils, our Department of Public Health, Department of Social Services, Department of Mental Health and Addiction Services, and our own agency, Aging and Disability Services, the legislature, but really, and also with AARP. So Nora Duncan, who is the state director of AARP, I always get stuck on that for some reason, the state director of AARP, and I were just asked to present nationally at the Ombudsman Day, National Ombudsman Day, on how our collaboration and work with all of you were able to move things forward. So I just want to thank you for that. And we have Jeanette on here as our panel member as well, representing residents. So Jeanette, thank you. And I know we've introduced you a few times, so I think at this point, people know who we have. I want to welcome Lindsay Jessup, one of the regional ombudsmen, who's going to read us the questions that are in the chat, and then we can respond to the individuals. There you are.
Sure, thank you, Mairead. So as Dan pointed out in the beginning of today's session, you can use the chat feature to ask any questions for our panel. You can also use the Q&A function, and we will be looking at those questions. You can also telephone in the question. Hopefully one of our team members can put up the phone number. If you want to leave a voice message with a question, we will be checking those for you. So one of the first questions that came in through the chat earlier this morning has to do with money follows the person. So Mairead, this might be a good question for you as you are the co-chair of the steering committee. So the question is, has there been any movement with the MFP program? It appears some of us have been waiting a very long time to move forward.
Absolutely. So one of the challenges that was faced during the pandemic was access to people coming and going. We know that that's been resolved, right? The MFP team members are able to go in and do assessments. But the other thing that we saw in our state was related to housing. And we know that housing has always been a challenge for individuals transitioning out of a nursing home. And because of the amount of people that are accessing housing in our state, maybe coming from other states, it really drove up the price and the access to housing. And that has been, I would say, one of the critical challenges that we've heard time and time again. So people will be at the end of the process, right? Your care plan's approved, you've done your RAP certificate, you have your voucher, and you're ready to go, and we can't find accessible housing. This is something that we have addressed with the governor's office. They're looking at ways to provide landlords with incentives to look at accessible housing, put things in place. There's new options out there. One is called the CHESS option, which is someone who has experienced homelessness prior to being in the nursing home. So there's things that we are working on. We are just starting to look at the ARPA funds, so the American Rescue Act or Plan funds, and how those will be used in a meaningful way to create access to home and community-based services and programs. And so through the steering committee, we are actively working on that. I know Anna's going to be on one of the committees. And so if there's other people who would like to participate in those committees and to know more about those funds and how we're going to look at providing access moving forward, please reach out to me. But if you're stuck, if you feel you're stuck or your case is stuck related to MFP, we want to hear from you as well. You can reach out to your regional ombudsman, and we can reach out to your case manager and your local access agency to see what that sticking point is and bring that back to the larger committee to see if we can find some resolution for you. So thank you.
Great, thank you, Maria. And one of the things I always appreciate about the steering committee is that it is a meeting that is always open to the public. So the public is welcome to attend, held every first Friday of the month from 10:30 a.m. to 12:30 p.m.
And if people would like a link, Lindsay, they can reach out. They can either get it from MFP or they can get it from us. Please, we want members ready. This is about doing with, not for. We want individuals that are receiving services, that are part of the community, to hear back from them and to help us understand what's needed and why. Very much to Representative Cook's point, like, we want to do this with you and make sure that it's meaningful.
Great, thank you. So one of the next questions, this can probably go to all of our panelists to all take an opportunity to answer. What would you say are the next biggest issues that are now being faced by people in long-term care communities?
Barbara, do you want to, what do you think is the biggest, this can be I think this could be a discussion between us. You know, what do you think is the next biggest thing?
I think as we are trying to do two parallel lanes for all of us in terms of the recovery phase of the pandemic has left a huge impact for residents in nursing homes and across the healthcare sector, consumers, and as we return to our normal state survey agency activities. And how do we get out that active presence, and how do we communicate at the department so that residents, patients, individuals living in licensed healthcare entities are comfortable with reaching out to the department? How do they reach out to the department to express any concerns or issues they may have? How do we continue? I think for all of us is very important. And I think convening this group is critically important. And how do we continue to maintain these kinds of dialogues and convene these work groups so that we are hearing from individuals in congregate settings or in long-term care facilities, so that we know what work needs to be done as we move forward. Certainly, the work that we do at the department continues to, what we believe, be a quality arm of healthcare and all the entities that are licensed by the department. But it's important that we hear from individuals who are living in that experience, where the challenges are, where the gaps, so we often think about things that keep us up at night at DPH, but also want to hear about what keeps you up at night and what collectively can we do better. So I think those are issues that we need to continue to work on. And again, partnering is critically important as we work that through.
Thank
So
you.
I'll stop there, Maraith, and give others.
I liked your, like, what keeps you up at night. And I think on that, I'm going to pitch to Jeanette, because we're talking about lived experience. What do you think is critical next, and what keeps you up at night? Dan, can you unmute Jeanette?
Oh, I can ask to unmute, but I can't actually unmute her.
All right. Jeanette, while you're getting unmuted, I'm going to jump over to Michelle. Rep Cook.
So for me, I think it's a little bit different. I do think that Barbara makes a very good point. What keeps you up at night, right? And And for me, what keeps me up at night is the low staffing ratios and knowing that somebody could be laying in bed for however long that they're laying in bed, alone, looking for somebody to take care of them, or being left in the bathroom, and having not somebody coming to assist them because they're down the hall, taking care of somebody else. You know, the one thing for me that becomes overly concerning about a nursing home is when family members leave at 8 o'clock. You know, and our staffing ratios are down, you know, it's one person to maybe 15 people, or maybe one person for 20 people, depending on if somebody called out and you don't have somebody that's coming in. There's just no human way that you can care for people of a variety of needs at that ratio. And so for me, that's what keeps me up at night. What keeps me going and grinding and really trying to continue to make good, effective policy change is that staffing ratio. And not only just the folks that are caring for them in the rooms, but it's also the social workers. It's also the rec staff. It's staff in general in a facility where people live there. This is their homes. And in my home, I don't have to fight about somebody taking care of me. I have the ability to change that. But folks that are in a nursing home, which is their home, that are, you know, they might not always have the ability to change that. And for me, it just breaks my heart knowing every night that somebody could be going without being treated the way or getting their needs met the way that they should be able to have that done.
Thank you. I'm right there with you. And I think Jeanette has been able to unmute. So Jeanette.
Yes. I would completely agree. I think the largest issue right now is staffing. I think nursing staffing, which would include CNAs, but I also think recreation, kitchen, laundry. I think it's just affected nursing homes completely out. What keeps me up at night is who's going to be here. And it's going to be somebody that knows me, that's willing, that knows my routine, that is going to come in with a kind smile, with no attitude, no rolling of the eyes, like, here we go again. I think a lot of our staff is in burnout because I appreciated the ratios you shared, Michelle, but realistically, for my home in the last month or so, sometimes it's 1/8 to 27, 28 people. And maybe a third of them are independent where you're just setting them up with towels and stuff and then following up with them. But I have waited an hour, hour and a half on a bedpan to get off. I've waited 20 to 30 minutes to get into the bathroom, to use the bathroom. So I know for myself, and I know I'm speaking for many people living throughout our state, staffing is the big issue. I think something we need to work on is not just the policies for hiring and the bonuses that they get if they do pick up, but there needs to be something given to the people that have been pushed through and have stuck it out and continue to come to work even though they're exhausted, because they come for the people that they serve, the residents. They come to because they love us and they care for us, and they can't think about who's going to be there and not do their job appropriately. With the lack of staffing, people are not always getting their showers. I didn't get a shower. I get showers twice a week. I didn't get one of my showers this past week because of staffing, the way the staffing was. It just wasn't going to work. I know I'm not the only one. And I have a pretty big mouth and I have no problem speaking up, for myself, but also for the others in my building that are not getting the services that they need. I have no problem calling somebody out on the carpet for it. I would encourage all the other resident council presidents out there to do the same for yourself as well as your constituents, because in the long run, it will benefit us. But I think staffing is huge. Every department has been affected. Every department.
Thank you, Jeanette. Anna.
Yeah, I couldn't have said it any better than Jeanette just said it, or anyone before, but the issue that we hear about the most is the staffing levels and just workforce in general. And the piece of that keeps me up at night is a combination of the immediate need, but how are we planning for 10 years from now, for 20 years from now? We're in the middle of a completely unprecedented demographic shift where by 2035, we're going to have in the United States, more people over the age of 65 than we have under the age of 18. So I think a lot of the ways that we've historically thought about providing a workforce for long-term care, which, has also in a lot of ways relied on unpaid family caregivers, especially in the community. How do we think about this very differently, and how do we kind of force our way out of old ways and patterns of thinking? And then I'll just add to that very briefly. In your response to the last question, you mentioned some of the challenges around housing. So how do we start to think really holistically? So we're not solving one issue at a time. So we're not just thinking workforce, and we're not just thinking infection control, or, all of these issues that are real and important, but how do we expand that thinking to say, if people want to receive care in another setting, do we have accessible housing available in our communities? Do we have, affordable healthcare options? Is Medicaid working as a way to pay for long-term care? I saw a question about that in the chat as well around Medicaid spend down. So, it's important to isolate and respond to these individual issues, but, my 2 a.m. thought is how do all of the pieces fit together? What does the puzzle look like?
Thank you. And I think you all hit on the areas of things that keep me up at night. And I will say, the last meeting I had prior to knowing we were going into a pandemic was with the Department of Public Health, the associations, and DSS related to staffing. This isn't, I think, unique during this period of time. This is something that was developing because of some of those career ladders that had gone away, the way the system was in place. And we knew that workforce development was going to be a challenge. And we honestly, I think in good faith, everyone was trying to move that forward, but we got sort of knocked off by the pandemic. And so we are seeing now, because of that, there were people that left this line of work. There are people that truly are burnt out. To Jeanette's point, there are people that have been working so long and so hard, and double shifts. How long can you do that? I know for myself, how long can you work at a certain pace before you either get injured? So we've had, people get hurt or just burn out. And so looking to Anna's point, looking at this holistically and not trying to solve one thing at a time. I am going to speak back again to the work groups that we have. There is one for model development. There's one for informal caregivers. Sorry, I'm reading them off my list here. Quality, one for quality. Assistive technology. I think that we need to look at how we can better use assistive technology in our long-term care communities, not to replace the workforce, but to assist the workforce. And there are some things that we can do, some things out there. We moved away from, and I'm wholeheartedly moved away from alarm bells and restraints, but I've seen some really cool new things that could also help alert staff if there's someone moving in a room. Maybe there are sensors that go to a beeper that tells someone, oh, someone in room 3 in the second bed is moving or is looking for assistance, and it quietly goes to a beeper or a way to notify them where it's not sending off bells and whistles, but calls the attention to that staff person who might be working with a lot of people at one time, and they want to be accountable, right? And they feel horrible when things don't go well. I've heard from a lot of staff, you've talked about showers, Jeanette, and that is something I would say in the past 2 weeks has come up the most, the missed showers that are happening, and what that means to an individual, right? And how the staff feel when they can't give that shower, but they know that they have to be able to care for other people. And so I also don't want this burden to just lie on the shoulders of the team members. Those care, we call them staff, but they're really care team members in these buildings. It is the nurse, the social worker, the rec, but really that direct care team member, the CNA, who has to come in and face that resident and tell them or sees them in a situation that they can't easily resolve. And so how do we give that person the tools to be able to respond and feel good about the work they're doing so they can continue to come in, right? And can continue to show up. And we are working on that. We're having regular conversations about workforce development. My team members met with the governor about our concerns, identifying and highlighting what we're seeing and what we'd like to see moving forward. So we do want to continue to hear from all of you. And as I'm thinking of this, Dan Beam, I think we need to maybe have a place on our website talking about staffing, developments, and some of the work groups, because again, we want to do this with and not for. So if people want to join those work groups, we'd encourage you to be a part of them. That was a long answer. Next question, Lindsay.
Sure, and I think that probably answers in part David from our executive board's question about where some of the focus needs to be next legislative session. So it sounds like staffing is a major issue, as well as workforce development. So we're going to go to our Q&A section, and this was submitted by Tom, who said that his mother-in-law is 101 and in a skilled nursing facility. She is on Medicaid and Medicare. She was maintaining the allowed $1,600 as the Medicaid asset limit, and then received all of the government COVID stimulus payments over the past year and a half. There is nothing our family can purchase for her that she needs to spend down the nearly $2,000 excess now, and she was denied for Medicaid at her current review period because she is over the limit. She has to go off Medicaid, pay private rate back down to the $1,600 asset limit to return to Medicaid. So his question is, how are families dealing with this situation? And my question would be, is this, I know that there was some letters sent by DSS and perhaps we need more clarification, but what is the current process for this?
So her being denied Medicaid because making sure that the nursing home is communicating to the worker that is due to stimulus checks increase and that they were given, and that's in the write-up from DSS about the timeline to use those funds, right? So what the individual wants to do with them. Maybe there are creative things that they can do, talking to the resident council, or is there something through that recreation does with this individual related to music? There's programs. Because she is 101, maybe virtual books, something like that, that we can have her purchase, but maybe can benefit a large group of people. We'd want to look at that and really see what's allowed and how to make that happen. Rep Cook?
So in that, that really frustrates me because nobody asked for the stimulus to come back, although it's greatly appreciated, especially for folks that are in the position where they really need it. But again, this creates that downward spiral on the adverse effects of a good intention with a bad outcome. I see Barbara smiling over there. So my suggestion, or maybe my question, and so this will be a question to a question, and maybe Barbara could answer that as well. So I know that we had done, electronics, iPads and things like that. And then we also just allowed folks to have cameras. Is those dollars, does that fall in line to something that they could spend those dollars on to benefit not only maybe her or her family and the communication or the safety if it was cameras, but then it could also benefit, maybe her roommate or depending on the situation or what her living arrangement is. So are they given a list of things that, and I hear what you're saying, Merritt, about what they can and can't use it for, but Barbara, are those items that they could use that stimulus dollar for? And my second question is, how long are they kicked off? Because getting re-approved is not even worth this conversation. We all know how frustrating it is, and you'll see horns grow out of my head in anger that the approval process is beyond frustrating. And then a reapproval process is even more frustrating. So to that, can they use those dollars and cents? And then how do we help?
So Representative Cook, I'm going to look to Maraith and her team to see if there's a list, because I'm not the expert on that. But I think that if the resident is going to benefit from that expense, that indeed they can purchase it, and then there's a multi-resident benefit. But I'm gonna punt to Maraith. This is called the sweep pass in football. So
Absolutely, yes, they can. So like we were talking about, the Echo Dots, the Amazon Alexas, and the use of them, families can absolutely purchase them, be able to talk to the person, play music on them, those types of things. Same thing with the camera. If they wanted to have a camera in the room, again, we'd have to have the roommate signatures. We want to honor privacy and those types of things, talk to the residents, but yes, you could do that. Programming, there is a program, a music and something program, but there's things that they could use. When it comes to how long are they off? They're only off until they can demonstrate the spend down. But like I said, DSS did put out memos explaining how they should qualify those on the redetermination. We have those on our site. It's accessible. So if you need that, the RO can certainly link you to that. And the timelines around that to spend it. And then the worst case scenario, which to me isn't necessarily the worst case scenario, the money goes back, right? It is, you spend the money, and when you're spending the money down, it's a pause in what the state pays. It's not like they're coming off Medicaid. It would be a pause. And then that money would go back towards their care and services, which that might be the most appropriate use for those dollars, you know, and then their Medicaid would resume. And so taking that step, and sort of to the last question, as we wound up, Lindsay, and into this, one of the things that I think it's important, and I know Representative Cook, this has been important to you, is the transparency around dollars, right? The increase in wages, and Connecticut did a great job advocating for that and making that happen. And that there has been extra money given due to COVID, now with these increases, and that's what we need to see, those meaningful wages for these careers and seeing them as careers, and that those funds are going directly to the caregivers, not in management fees, not in other things. But I'd like to see the transparency around that this year in session. So I'm throwing that over to you, Representative Cook. I really want to see transparency where these dollars are being spent, and that they're going to improve the quality of life and the quality of care for residents, which means getting those dollars in the hands of the staff that are the frontline staff, the nurses, the CNAs, the rec, the social workers, maintenance and housekeeping, who have incredible relationships with residents. And I think people forget that often, and have been there. Without them, we wouldn't have survived the pandemic. So to you, I'll softly pitch that to you, or however Barbara said that, punt, that's something that I think we need to see. Where are those dollars? And if they weren't spent appropriately, that they come back into the system and are reallocated in a really appropriate way.
Yeah.
I'll receive that punt with no problem.
Having them make a living wage, Michelle, I think that's important. You know, CNAs working 2 places or 3 jobs just to pay their monthly bills, and they're stressed and they're tired and they're giving it their all, and they're making barely a little above minimum wage. It's just unsightly. It really is. It's disgusting in our society that people that are taking care of other people are making the same amount as a college student just starting out on their career. It's just not right.
Well, Jeanette, and everybody that knows me knows that this has been something that's been on in my burner since pre-pandemic, right? So, you know, that's something that has been so vitally important to me. And then the transparency piece became even more evident when I found out that when we did the raise increase, 3.5 years ago, maybe, that some facilities never released the wages. And that just became so infuriating to me to feel that, you know, that we said, all right, look, we're giving you this to raise them like 4%, and it was never received. And then the pandemic hit and said, oh yeah, well, we can't give you that because we're spending dollars on the pandemic. Completely unacceptable. And I would go well beyond, you know, a respectable wage, and it's got to be above a living wage, because a living wage is varied between persons, right? So a living wage for me might be different than a living wage for you, which might be different than a living wage for somebody else. And I understand that we don't necessarily govern that way, but at the same time, when we're talking about having people take time away from their family to do their job, which every job we do that, but in the healthcare world, we're putting people on the front lines of a lot of other things, and to treat them with dignity and respect. our caregivers, for me, goes above and beyond where we are. And so I'm in your corner 100%, and I look forward to continue working on that one. Transparency for me cannot be talked about enough. So
Thank
Well,
you.
thank you.
And I think especially because for the most part, we're talking about taxpayer money. So much of how we fund long-term care, in Connecticut and nationwide is through Medicaid. So,
Right.
I think it really is a value statement for what do we as a society and as taxpayers and, as government entities, what do we value and how do we, how are we good stewards of that money and using it in a way that it really serves residents. I think some states I've seen legislation wrestling with this in different ways in different states. New Jersey passed a bill in late 2020 that implements something called a direct care payment ratio, where 90% of the state funding going to nursing homes has to be going directly toward resident care. There's also the process, there's kind of what it says on paper and then how things play out in reality after the fact. And, I think in the case of New Jersey, my understanding is that on paper is better than in reality at this point. But, I think it's a conversation worth having. And I think it's so valuable, to hear directly from residents about, what does it mean in my minute-to-minute life when there's not adequate funding to support the workforce that is supporting me with my, with my ADLs and my day-to-day. And, Jeanette, some of the issues that you've brought up and some of what I'm seeing in the chat, just helping policymakers get in that mind frame of how long do you want to wait to go to the bathroom?
Right.
How many hours a day, do you want to spend waiting for food? How many minutes of your day do you want to spend being uncomfortable? And I think, I don't know, you all are a really powerful group of communicators and storytellers. And, it's important for advocates to hear too, because I can say, well, I have reports and numbers that say X, and in theory, Y should work. But to be able to say, I heard from this real human who lives in this real town, and this is their real experience, the power to that is really important.
Absolutely.
And I'm happy because I live in one of, I think, a very, very nice nursing facility.
Mhm.
And I think they try really hard to make their residents happy, but you can only do so much with what you've got. You can't give something you don't have. And I feel for those that are not as fortunate to live in a facility as nice as mine.
I think we
But
need
they
to
also do
identify as well, Jeanette, and you've brought this up to me, the idea of pool, right? What we have seen,
Right.
and I think we need to come out strong. Again, I'm going to pitch this over to Representative Cook, a way to cap what pools can charge for staff in a building, because what we see is the individuals showing up and working for the nursing home don't get paid as much as the pool staff coming in. And so we see people leaving and going just to work for the pool, which is destabilizing our workforce in the nursing homes. And if they paid more at the nursing home, there would be less incentive to go to the pool. And these pools that just bring people on, and then the accountability, right? If there's abuse, if there's neglect, if things happen, well, they're pool staff. Well, I get that, but they're still caring for the individuals in the home. So we've heard that a great deal lately. So, and the nursing homes, I think, and the associations are on board and looking for support in how we kind of control this wave that's happened related to going to the pool. But I do think it all goes back to ensuring that the individual that's working is being paid adequately where they're at and getting benefits, right? Because if you work at the nursing home, you get those benefits, the time off, the health care, versus going to the pool. And if we do that, we have better care outcomes. They know their residents, they know how, and it takes less time. All of these things feed into each other.
Less anxiety on the resident receiving the care as well as the person giving it. We're experiencing that in my home right now. We have 3 pool nurses working in 1 CNA pool, and they're wonderful people and they give good care, but they don't know us the way somebody who's been working here for 13 years and has not gotten an increase and is not being motivated to want to continue to stay here when a facility a couple miles away is offering $5 more an hour and less work and better benefits.
Right.
So we need to work on that. That is something that we really need to work on this next legislative term.
And Jeanette,
accountability is key.
And Jeanette, to that point, I think it became very evident during the pandemic when we were making directives that said you can't switch your, you can't do double, shifts in different facilities, and you shouldn't go from unit to unit. But there was, because people made so little money, they were picking up shifts everywhere that they could. And then that was also creating a spread of a virus that we couldn't get a hold of, and not to the fault of theirs. I mean, you have to be able to put food on the table and pay your bills to be able to live where you are. And I know that we've gone over and over this, but I compare the ratios that we have instilled for infants and toddlers, and this is not a disrespect to anybody. So, but we've instilled a ratio of infant to toddlers, like 1 in 6, one infant to every, or one adult to every 6 infants, and then 1 adult to every 10 toddlers. But and if you don't meet that ratio, you could be closed down. We don't enforce that ratio in our nursing home care facilities the way that we enforce it in our early childhood facilities. And for me, I'm much bigger than an infant or a toddler. I require more care. And I know that and so that's how I look at this ratio. Why are we doing it and enforcing it so heavy-handedly? And I don't think it's a bad heavy hand in this regard at the younger ages, but we're not doing that at the older ages. That for me is unjust and disrespectful and just not the way that we should be taking care of our folks. So,
well, thank you. And with that, we again have, this always happens with our live question answer. I'm sure there are other questions in the chat. We will get answers to people. We'll let people know what those questions were related to our long-term care communities, but I want to be respectful of time. I know we've heard from some people, they're getting ready to go to lunch. I wish we were having lunch together at the AquaTurf today, but we look forward to that next year with all of you. And we hope we're in a very different, I'm counting on the fact that we're going to be in a very different place then, and that we'll all be able to meet face-to-face and be together. And I had a much longer closing written, but I will say, I want to thank everyone who participated today. Again, a special thanks and shout out to Dan Beam and Lindsay Jessup for all of the work that they did to coordinate this, as well as the rest of our team. So there's always people working behind the scenes. Commissioner Porter, thank you for being here today and always supporting us in the work that we do. Department of Public Health, Department of Social Services, our legislative representatives, and AARP. But the biggest thanks go to all the residents and our long-term care communities that are on here. Please continue to send us information.
Yes.
Let me know what you want to hear on the podcast. Again, it's still clunky, guys. I know it. It's harder to do than you might think, but I'm working on it. So I welcome feedback. Thank you, thank you, thank you. And I hope you have a great rest of your day. We'll be talking to you during session.
Thank you.
Thank you.
Thank you, Commissioner, and thank you, Maraith, and good morning to the E-Board, other resident council presidents watching today, other residents and family members, advocates, and other stakeholders. Again, my name is Dan Lerman, Regional Ombudsman with the Long-Term Care Ombudsman Program. Session expectations this morning, I'm going to be providing a big picture Connecticut legislative update and nursing home landscape discussion, and tag teaming with my colleague, Regional Ombudsman Dan Beam, who will be discussing selected nursing home related past bills in more detail. Landmark, unprecedented, seismic Connecticut legislative bills passed this session in response to the pandemic and the hardships and losses over the last year. Legislation is often incremental with gradual advances, not this year in Connecticut. Before we get to specific bills, let's look back and discuss some of the lessons learned and the session process itself. The 2020 Connecticut legislative session was cut short in March 2020, and the legislature granted Governor Lamont executive powers and authority to address the COVID pandemic. The governor's executive powers were extended multiple times, and in late September 2021, the legislature met again in special session and extended executive power authority for the governor into next year. Governor Lamont issued Executive Order number 14, extending certain long-term care facility testing, masking, vaccination, and temporary nurse aid executive orders again in late September. Some executive orders expired this summer, like prohibiting nursing home and residential care home discharges to homeless shelters or temporary housing. With a 100-year pandemic, there were lots of unknowns and changing scientific guidance. There was concerns about availability of PPE and testing supplies. Infection control expertise was needed, along with knowledge how best to cohort and care for residents. Bills passed addressed these and numerous other issues. Stakeholder coordination and communication generally was good and improved during the pandemic, not that all parties agreed on issues. The Ombudsman program had a greater seat at the table and played an important role in helping to highlight and advance many of the resident-centered legislative proposals. The e-board was featured in Kaiser Health News for their virtual testimony during the 2021 Connecticut legislative session. The Center for Medicare and Medicaid Services, CMS, had blanket waivers, and there were other waivers and changes occurred impacting resident care. Room transfer rights were changed, resident cohorting decisions, record request turnaround times, visit restrictions were put in place at many places. Payroll journal-based actual staff reporting was put on pause for a quarter or more. In-person appeal hearings for residents were suspended, and many were later made virtual. There is greater flexibility to hire temporary and out-of-state workers. A new temporary aid position was approved. There was major advancement in telehealth use. License renewals were extended. And on the voting side, absentee ballot and other voting rights expansion occurred. The Connecticut Nursing Home Financial Advisory Committee met regularly and reviewed the state of Connecticut nursing home care, finances, staffing, and operations. Occupancy declined from 88% pre-pandemic to 70% at the worst in the last year, and has bounced back to about 77% in August. In the August report, factoring in almost 300 bed closures. Additional closures and system consolidations may be a result of the state of the nursing home field and industry. The Office of the Inspector General and the General Accounting Office published reports on nursing home infection control, COVID disparity impact, better oversight needed in nursing homes, backlog and standard state surveys. CMS expanded the special focus facilities listings, which are poorer performing nursing homes. Last year or more, an abuse icon was included on nursing home compare sites where applicable for a specific facility with an abuse citation. Now, what are we seeing? Compared to when COVID first hit and the focus on the older population, now 29% of new cases nationally are kids and 30% are breakthrough cases or people who've been vaccinated. Roughly 76% of hospitalized COVID cases in Connecticut are unvaccinated individuals. At the peak period of the outbreak in 2020, there were roughly 1,500 to 2,000 hospitalized COVID patients. And in December 2020, with another spike, there were about 1,200 hospitalized COVID individuals. Now there are about 250, though there has been recent spike and decline. There are pockets of the country with major outbreaks and hospital and ICU capacity issues. Connecticut is a much different story with a high rate of infection. Switching to the 2021 Connecticut legislative session and bills. It was a long session from January to June with a budget focus this year like every other year, and there were multiple special sessions. Lots of governor executive orders and DPH commissioner orders in response to the pandemic. A possible large nursing home strike was averted with state wage enhancement and other support. There was a state and presidential election last November, and since we've had greater White House support for long-term care services and support and home and community-based services, and less of a deregulation focus. In Connecticut, Democrats held large majorities in the state Senate and the state House, and there were veteran legislative leader retirements last fall and some new legislative leadership and committee chairs this session. The Connecticut state budget that passed in June or July was much better than expected compared to year-ago projections, with a rainy day fund that is strong, rising tax receipts, and lots of federal support, including for nursing home residents, staff, and providers. As mentioned, the General Assembly was not in formal session March of 2020 to January 2021, and it was virtual for most of the 2021 session. Bills floated in years past that did not gain traction passed this year. It shows the ongoing advocacy efforts needed. Personal needs allowance, video surveillance, increased rights for home-like environment, just a few examples. Regarding some specific nursing home and long-term care bills that passed, Senate Bill 1030, again with the corollary public act, and we'll have this information on the Ombudsman website. But Senate Bill 1030, nursing home and dementia programs, is a wide-ranging aircraft carrier scope bill with resident protections and provider accountability and responsibility, improved direct care staffing, and better social work and recreation staff requirements, and a focus on meeting the social and emotional needs of nursing home residents and supporting person-centered care. That's Senate Bill 1030. Budget Bill 6689 increased the personal needs allowance from $60 per month to $75 per month for eligible residents. Again, the P&A was temporarily reduced 10 years ago. And again, advocates, residents, e-board have fought hard to get it restored and increased as it was. Senate Bill 975, Patient Bill of Rights expansion to include the right to home-like setting and use of technology of one's choice, including video surveillance, Alexa, and emerging technologies with appropriate safeguards and protections. Senate Bill 6457, access rights to technology use. House Bill 6634, essential caregiver rights. Again, a key cry for family members, friends, other loved ones for visitation rights during the pandemic. Senate Bill 3, resident and family council rights for input on legislation and regulation, and nursing home responsibility to promote family councils. Another bill, Senate Bill 1, the priority Senate bill that includes racial justice and public health commission to be established, and many other bills that had focus on protections on equity, disparity, diversity, gender, sexual orientation, hate crime, and harassment. A bill requiring hospitals to ask hospital patients if they want a patient caregiver contacted and not just a responsible legal party was passed. The Ombudsman convened Inclusive Communities Work Group, ties into these and other diversity equity measures. Two specific long-term, non-long-term care bills passed that pay mention. Number one, legalization of adult use marijuana, and number two, sports betting and wagering. They were passed for a variety of reasons, but I mentioned these because they're two revenue sources that down the line can help support needed programs like nursing home and long-term care services and support in the social safety net when the economy may take a turn down. At this point, I'd like to shift to federal legislation and summarize discussion today. Number one, nursing home improvement and accountability bill has been introduced in the Senate in a companion bill in the House, a broad-based bill to have study on staffing and lots of protections for residents. An essential caregiver bill has been introduced, and the state ombudsman, Maraith Painter, is working hard in her national leadership role to try to advance that bill. Elder Justice Reauthorization Bill 4969 includes funding for the long-term care ombudsman program. In the news, as of the time of this recording, have been congressional debates about reconciliation and infrastructure bills, and the reconciliation bill, if passed as the Democrats want, would have a great amount of health and social safety support items included, including a lot of home and community-based services supports. Congresswoman Jan Schakowsky introduced House Bill 598 to increase federal mandate for nursing home staffing to 4.1 hours per resident per day and required minimum RN and LPN hours. On the national stage, the US Senate is divided 50-50, with Vice President Harris casting the deciding vote when Democrats can garner 50 votes. The US House has a narrow Democratic majority, and the 2022 midterm elections will results change the balance of power in the House. Connecticut is fortunate to have strong federal legislators. Just a few examples. Representative Rosa DeLauro is chair of the House Appropriations Committee, plays a key role in spending allocation. Senator Blumenthal is a strong leader on elder justice and nursing home issues and serves on the Finance Committee. Congressman John Larson plays a key role in advocating for Medicare reform, including efforts in the reconciliation bill to expand Medicare to include dental, vision, and hearing benefits. There have been recent allocations to the CDC, $2.1 billion CDC investment in infection control, including $500 million across the continuum of care to include focus on nursing home strike teams where needed around the country. In summary, regarding legislation and the big picture landscape, there have been major positive advances in legislation to protect and enhance resident rights in health and safety. There is still much work to do, including better overall direct care staffing requirements and other protections and support, such as workforce development and career ladders for staff, which have been voiced by the e-board strongly. Nationally, nursing home staff turnover rates are reported to be the highest in the past decade. In July 2022, the Connecticut Department of Social Services will implement a new acuity-based payment system for nursing homes, and the Ombudsman program has been advocating for strong quality and staffing incentives in this new payment system. A shout out to the residents, family members, other advocates, and stakeholders this legislative session. Your voices were heard. A reminder, please go to the Ombudsman program website for great resource material. My colleague Dan Beam has done a great job making the website a go-to place. At this point, I'm going to hand the baton off to my colleague Dan Beam for more detailed 2021 Connecticut legislative session past.
Hey everybody, it's great to see you. It's State Representative Michelle Cook here. I am serving in my 7th term at the State House, and I just wanted to say thank you very much for once again welcoming me into your screen and having a conversation about advocacy and how it is that we can work together and partner to ensure that the great work that you all are doing helps us do good work to better the quality of life that you all have. Before I get into that though, I know the last 18 or 19 months have been very difficult. We've lost family members, loved ones, roommates, staff. And I just wanted to take a moment to send my condolences to each and every one of you that have lost somebody that is meaningful to you in your life. It's been a road of which we could have never prepared for, not one that I hope we ever have to go down again. But at the same time, I believe that together we've been able to get through it this far. And hopefully that during this past legislative session and during this time of uncertainty with the pandemic, that we've been able to do some great things for all of you. And I'm hoping that we can continue to do that. So in that regard, COVID hit my home like it has hit hundreds of thousands of people's homes. And it is important that we do not continue the conversation that we're going to have without acknowledging the loss of those lives and sending out my condolences. So where do we start? How do we make lobbying and advocating for you and your quality of life? How do we make it better? How do we make it easier? How do we smooth that transition? And for those of you who have never advocated or lobbied for anything yet, but now this is your first at it, I wanted to give you a few hints and some pointers and some things that really are effective when somebody comes to talk to me. And what I have found to be effective is I've partnered with a variety of different groups over my almost 14 years in the legislature. As you know, or maybe you don't know, I sit on the Human Services, Education, and Public Health Committee, and I have also served on the Aging Committee. And I have always believed that as we age in this great world, if we're blessed enough to get there, that it is our responsibility to ensure that folks that need things as they're maturing, they have everything that they need. And often we don't know how to get that. We don't know how to fight for ourselves, or maybe our family members don't know how to fight for us. So I've tried to figure out a way to make that easy for you. You have a voice. That voice, whether it is the ability to speak, the ability to send pictures, the ability to write a letter, take a video, you have a voice, and in your voice has a story, and every story matters. And for legislators, we are responsible for 3.5 million people in the state of Connecticut. And then that trickles down accordingly. And it becomes complicated to figure out, all right, how do I decide that this is the group I want to listen to, or this is the group I'm going to fight for, and then put somebody else on the back burner. It's very hard to spread yourself to a point where you're not missing anything at all. But our job as legislators is to do just that, not to miss anything at all. So the way that I often say is, back to your voice. How can you get your story across? It's personal. So I can tell you that I had a father-in-law that was 91 years old, and he was a Korean War veteran and had to do 10 years in a residential nursing home facility for some rehab. He went in for rehab and we found out that he had Parkinson's disease. He'd lost his wife about 6 years prior to that, after they had been married for 50 plus years. And for us, he didn't want to come live with us. We would have had him here. He always used his voice. He was legally blind. And he made sure that every time somebody came in to his room, he says, hey, just so you know, I can't really see you that well, but I want you to know that I'm blind. I'm going to need a little bit of help. Because he knew, even though that we, his family that loved and cared for him, were there 3 or 4 times a day, we couldn't always be there. And he didn't know if every person that was working with him was the same person that had worked with him before. He was using his voice. He was advocating for himself. And then that gave people the understanding that they needed to care for him just a little bit differently. Maybe he needed somebody to walk with him. Maybe he needed somebody to help feed him that day. Maybe he needed to be ambulated to use the facilities. But at the end of the day, he was advocating and he was using his voice. And he knew that the care that he was going to receive mattered. The reason why I tell you the story about my father-in-law, we called him Pops. We miss him dearly. We lost him to COVID very early on in the pandemic, was because I learned a lot from him. I learned that if you were repetitive enough, if you told your story enough, if you explained enough just how your care and your treatment affected him, and he explained what he needed from the people that were taking care of him, then it was a better relationship. That's what I think that we need to do as residential care council and your legislators. You need to tell your stories. You need to tell the stories of those members that live in your facilities. Whether it's long-term or short-term, everybody has a story. Everybody needs care. And maybe not everybody is comfortable with using their voice the way that you might be willing to use yours, or I might be willing to use mine. So how I envision a relationship with the resident council groups and their legislators is you all have meetings. I know that we've been in a little bit of a disarray and, you all are able to maybe meet in person, but we might not be able to get in the door. But we have this incredible thing called Zoom that I know that we're extremely tired of by now. Invite your legislators. Make sure that your local legislators know who you are and make sure that you know who they are. If they don't do their job, you have a way to get rid of them. You have a vote. And for you to be able to get involved in your elections. I know that the last election, a lot of times people weren't able to get into the facilities to be able to help somebody fill out a ballot or even maybe ask for an absentee ballot. Well, there's municipal elections coming up in November, and then next year we have a very big election. But in between then, we have another legislative session. And even though our entire state and our entire country was in the middle of a crazy pandemic and we were all trying to learn on our feet and figure things out as we went along, we still had a legislative session. And the reason why I spoke to you about my father-in-law was because of this. He passed on April 2nd. On April 17th, I wrote a letter to the governor using my voice, explaining to him just how much I thought we needed to do to help change things for folks that might not be able to fight for themselves. I called for a statewide investigation of nursing homes to ensure that everybody had the care that they needed. And if they didn't, what could we do better? And if there were things that they needed, we needed to figure out how to get them what they needed. But at the same time, it wasn't just about the pandemic. It was pre-pandemic and it will be post-pandemic. How can we make lives better? How can we make sure that you have ample staff? How can we make sure that your living arrangements are better or that you feel safe and secure? Maybe that you have a complaint about the food. I used my voice, just like my father-in-law used his, just like you are going to be able to use yours. We have to ensure that you also get your loved ones involved. And I know that this is about the resident council presidents primarily and other organizations that are here in this meeting, but I'm sure that there might be a loved one out there listening. But if there's not, then this is a little bit of information for them and you all can share for them. They too have a voice and they need to know that you need them. And they need to know that you need their voice to help you fight for what you know is right, what you deserve. So have your family members do exactly the same thing that we're saying to you. Get to know your local legislators. Have them get involved. Develop a relationship. Maybe have your family members host, a meeting, whether it be via Zoom or in person, and have a conversation. Maybe there is families of like mind that have, members that they've become friends with in the same facility or different facilities across the state. Get together, sit down, have tea, have coffee, and just talk. If people hold everything inside, there's never going to be a way for us to know what you're really feeling. We're not going to know. We can't read your minds, although I wish that we could. So we have to have those conversations, and those conversations need to be consistent. And consistency definitely includes your friends, your family, and your loved ones. Because if we don't share our experiences, we'll never get to change those experiences for the better. So last legislative session, we did some amazing things. We were able to increase staffing. We were able to increase accountability. We were able to put cameras in your rooms if you wanted one, if that's made you or your family member feel more comfortable with your care. And we gave you all the opportunity to say, hey, look, we heard you. We hear what you're saying. We know things haven't been right, and we want to try to right the wrongs. And we want to ensure that the path to the future is a more consistent and safe path. Nobody should be afraid to file a complaint. Nobody should be afraid to pick up the phone and voice a concern. There should be no room for retaliation. But at the end of the day, we know that that becomes a fear for all of us. If we all stay consistent, if we all stay in communication with each other, it's like having one piece of, granular of sand. One granular might not amount to a lot, but if you put a lot of granulars together, you have a beautiful beach. And that beautiful beach makes a statement. So if we put all of you together, all of your stories together, we stick together, we work together, and our messages are consistent, we can make great changes, but we can't do it alone. So as we move forward into our next legislative session, and you all move forward with your resident councils and the changes that are happening there, I want to just give you a few things to take away. You have more ability than you might recognize. You have control of our narrative. You can pick up the phone. You can call us in our office. A lot of us have our phones that are listed online or in the phone book, if anybody has one of those. We all have an email. We all have a Facebook page. But again, we also have to live in the district of which we represent. So you can find us at a very easy way. And if you can't find us, call me and I will help you find the legislator that is responsible for your area. And then we'll connect you all together. If you need help getting somebody in to a resident council meeting, give me a shout, let me know. And I will reach out to my colleagues and say, you have an obligation to listen to everybody, regardless of who they are, where they live, and what their needs are. And in closing, let's not forget that we all deserve the care to be able to live a happy, healthy life in a safe environment. Your care matters. Your voice matters. And if none of those things feel like they're working for you, make sure that your vote matters. Because together, advocating, lobbying, and talking is the way that we can make effective change and get things done. I want to thank you all again so much for the opportunity to be here. I'm Michelle Cook. I cover Torrington, and you are more than welcome to reach out to me for any of the needs that you have. And I promise you that I continue to work to fight for all of the needs of our residents in our care facilities, as well as those folks that decide that they want to care and age in place. Because at the end of the day, it's because of you all that we're still here and able to do the things that we're doing. Thank you so much, and be safe and be well.